Okay, we're going to continue our discussion, chapters 19 and 20, Injuries and Fractures, Part 2, using our external cause codes. The next guideline we're going to talk about is the coding of injuries. And here I have a diagnostic statement where the patient sustained third-degree burns to the back of her hand. And I've highlighted just the injury itself. The principal diagnosis in this case is that skin graft failing, because that's why she's come back into the hospital to have her allograft removed and her artificial skin graft put over the burn area so it'll heal better. So the complication code is the principal diagnosis and then the burn code. And now we're going to add the external causes, the boiling liquid splashing from a pot on the kitchen stove, and I've added here those two codes, the burn from a hot liquid and the place of occurrence in the family kitchen. The next slide, I just want to show you when something changes. This time we are looking at, we've been given the status that this is a person working as a chef, and while she's at work, this boiling liquid pops out of the stove, out of the pot, and hits her on the back of her hand. So that changes our codes. We still have the boiling liquid cause code, but the place of occurrence is now a restaurant, and the status is the civilian activity done for her pay, her job. The next guideline has to do with making sure your most severe cause of injury is the principal. The case that I've given you here, the diagnostic statement, the fact that this patient needed an open reduction internal fixation, ORIF, of his left hip fracture tells you that is the most serious injury. You also see here it is displaced. The other two fractures are non-displaced. So the displaced fracture that lands him in the OR is going to be the principal code, principal diagnosis here. The next two, either one of them, because they're both non-displaced, either one of them could be the second or third code. What really matters is that principal diagnosis has been designated and you've included them as secondary codes along with the external cause codes. And here I have the next guideline talking about superficial injuries. And I have the very same diagnostic statement, but at the very bottom of that diagnostic statement, it says he suffered multiple bruises and abrasions on his left side. We do not code those. When you have something as serious as the left hip fracture needing to go to the OR for fixation, you are not going to code those bruises and abrasions. You're just going to focus on the more severe injuries. The next diagnostic statement has to do with a person getting their arm caught in some farm equipment, and it caused an open fracture of the right head of the ulna with injury to the ulnar artery at the forearm level. It is a Castillo open fracture type 3C. Look at this one for a couple of reasons. One is that you have a different seventh character that we may not have used before, and the fact that it is injury to the ulnar artery as well. So that second code gets a seventh character A for initial encounter, because when you look at the category code for S55, there's no option to put a C. So you have to just use the codes that are available to you. In this case, the ulnar artery gets the A seventh character, and the open fracture of the head of the ulna gets the seventh character C. And here we have the same diagnostic statement, but we have added our external cause codes, caught in farm machinery, occurring in the field, and activity I put land maintenance. I couldn't find farming, which surprised me. So I went this route, but it may be that the next 2017 codes are going to have more options for us. But this is what I chose. The next coding guideline has to do with coding traumatic fractures, where when a fracture is not specified as open or closed, you're going to code it as closed. And if it's not indicated as to whether it is displaced or non-displaced, it is coded as displaced. The diagnostic statement I've given you, the child was playing ice hockey when he was struck by another player, causing him to fall, and he fractures his wrist bone. The diagnostic statement does not tell us if this break is displaced or non-displaced, so we are going to code it as displaced according to our coding guideline. And we also do assign the 7th character A for the initial encounter. The same diagnostic statement, now we're going to add our external cause codes, and we have them here at the pathway on the right. You notice that the W03 code does use a 7th character, but the 2 Y codes, the place of occurrence and the activity, do not offer you the option of adding a 7th character. And just for a reminder, the place of occurrence is only coded on the initial encounter. If this patient is seen in follow-up in his physician's office, that place of occurrence code is never going to be part of the codes, just the initial encounter. Okay, here's another guideline talking about when we use active treatment. The options are given for A, B, or C as our 7th character. I use the same diagnostic statement we used earlier with the farm equipment, and I show here in our path how I use those. The Gastio open fracture type 3C is there for the 7th character C. In the past, I don't recall, before ICD-10, I don't recall fractures very often being stated as being a type, Gastio type, but we certainly are seeing it in ICD-10. And here we're going to look at the subsequent encounter. We've talked about, I'm sorry, I'm wrong. We're talking about the initial encounter still, but when a person has delayed seeking treatment, that's what this diagnostic statement refers us to. The patient's complaining of left foot and ankle pain, fell down the steps 3 weeks ago but didn't seek any care, and now when we x-ray her, she's got a malunion of a non-displaced fracture of the posterior process of the left talus, a very specific place that her ankle is not healing. So I have the codes here and a reminder that we have to use A, even though she fell down 3 weeks ago. It's A for initial encounter because this is the first time she has sought medical treatment, and now she's got a malunion of that talus fracture. And here I've added the the external cause codes. She fell down the steps, and it's in the public library. Now we're going to talk about the subsequent encounter and how that is broken out. There are more options than just D for subsequent encounter depending on the code. In this case, that ulnar fracture, the Gastio open fracture type 3C, when you go to the subsequent encounter for that same type 3C, with routine healing, you're now going to get a 7th character of an F as in Frank instead of the D. However, the ulnar artery code retains the D for subsequent encounter because there's no other option. Also for the W30 code, D subsequent encounter, there's no other options for other than A, D, or S. And then we do not code the place of occurrence. That is only coded in that initial encounter. This encounter is, he's in the doctor's office to have his pins removed from remember the surgery he had? He's in the doctor's office now having those pins removed. And whenever we are coding a complication of surgical treatment for a fracture repair, we're going to use the complication code. In this case, it's a complication of the fixation device. And I have the T84 code, that would be your principal diagnosis. Then we have the injury to the right tibia shaft, Ch.30.221 for initial encounter, and then the W code for struck by an axe, bounced off of a rock. I think the next slide is where I add that. Yes, here's where I add the external cause code, contact with an axe. The next guideline has to do with the malunion and the non-union, something we've already talked about. But in this case, the patient did seek treatment. If you read the diagnostic statement, he was brought to the ED by family, and they reported his hip was broken during Hurricane Diane a month ago, and he was struck by falling debris during the hurricane. He was seen in this hospital on the day the hurricane hit. We checked the records, and the original fracture was a closed fracture of the left femoral neck. X-rays today reveal there's a malunion of the fracture of the left femoral neck, and orthopedics was consulted. So we do still have an injury code, but we're going to assign the 7th character P as in Paul, because this is a subsequent encounter for a closed fracture with malunion. If we go to the S72 category, we see the pink box just under the category code telling us that yes, we can use the 7th character P. The next guideline has to do, I'm doing it again, I'm jumping ahead of myself. These are the external cause codes for this gentleman. We've added the hurricane there, subsequent encounter, because remember he was seen originally, so it is a subsequent encounter. And then the W20 is the flying debris, also a subsequent encounter. And the place of occurrence where he fell is not coded because this is the subsequent encounter, not the initial encounter. The next coding guideline talks about osteoporosis. When someone has osteoporosis and either do or do not have a history of pathological fractures, they can do something as simple as stepping off of the curb and a bone will break. We do not use external cause codes because this is a very unusual case, but the patient does not get the Chapter 19S code for the injury. We go back to M, category M80, which is used for anyone with known osteoporosis who suffers a fracture. We are going to use that history of personal healed fractures from osteoporosis because it just gives more information and tells the story of this patient's encounter. No external cause codes are used. And the last one has to do with multiple fractures, going back to the motorcycle accident where he had all those fractures. You're just going to make sure that the most serious fracture is the principal. The fact that he had to go to the OR tells you that the left hip fracture was the most serious and is the principal. The two non-displaced fractures are the clavicle and the upper end of the humerus. Either one of those could be second or third because they are the same in severity, but the hip gets the principal. I know I've gone through this very quickly, so please take your time and read through the coding handbook chapters. Review the codes, the pink boxes that tell you your options for 7th characters, and always read all of your guidelines related to injuries and fractures. The next thing I'll be talking about will be Chapter 19 burns and external causes.